There's no end in sight for the nurses' strike that is now in its third month. The situation compounded by the entrance of clinical officers and pharmaceutical technologists. Since the nurses went on strike, clinical officers have been offering essential services, including emergency services in public hospitals. However, the decision by the clinicians to down tools over the SRC job evaluation report that classified them as semi-skilled has become the latest thorn in the flesh of thousands of patients across the country.
The ODS report from the SRC, which actually has downgraded clinical officers. It means that the clinical officers currently, as we serve, we are not professional against what is provided by the Act of Parliament and actually our scheme of services. And we say as clinical officers, the services that we have been offering to Kenyans since 1928 cannot be washed away by just a report from the SRC. And we are actually holding that until we are fully graded as the professional who are actually highly skilled.
Kenya Union of Clinical Officers Secretary General George Gibore says they will in no terms allow the demeaning of their profession.
The clinical officers exist in Kenya because of the Cap 260, which provide for their professionalism. We have also currently an operational job grouping, courtesy of the Public Service Commission, which recognizes clinical officers as professional and highly skilled, including our scheme of service, which is a public policy, which is a government policy. It also recognizes clinical officers as highly skilled. Remember, clinical officers go to school for 3 years and actually 1 year of internship, that's 4 years, to do their diploma. For those who do degree, they go to school for 5 years and then they go for 1 year intern. Those are 6 years. We are saying that we cannot allow anything that degrades clinical officers, which undermine our qualification.
The attempts to serve SRM with their petition have, however, been proved futile. The strike that began mid this month, if unresolved, could now see a total paralysis in the health sector, exposing many Kenyans to untold risks. Clinicians say they will be holding demonstrations every Monday until their grievances are addressed. In Baringo, Moses Mulo, a proprietor of Tiobei Medical Clinic, says they have been forced to recruit more nurses to remedy the situation.
A lot of influx of patients coming to the clinic due to the strike which is going on in the government hospitals. I'm seeing a lot of patients coming in, and the demand of medical care is quite high, and I'm doing as much as I can.
Gladys Kurgat from neighboring Elgeyo Marakwet County, who had brought her sick grandmother to Baringo Referral Hospital, told KBC she has been forced to dig deeper in footing for her grandmother's medical bill.
Nilikuwa nimeleta mgonjwa kwa hospitali ya district, alafu kupika huko wanasema manurses wameenda strike, ndio nimehangaika nayo, nimekuja mpaka private hospital. Nimetumia pesa mingi ambayo hata sikukuwa natarajia.
In Machakos, nurses say they will not call off the strike until their demands are met. Only last Friday, a stakeholders meeting that brought together the governors, the Salaries and Remuneration Commission and the Treasury sanctioned the sacking of health workers who do not resume duty. In compliance, Murang'a and Kiambu counties have already begun the process of recruiting new nurses. Carol Kamau reporting for Channel 1 News Hour.